Hi everyone, my name's Lauren, I'm a physiologist from AXA Healthcare, and today I'm going to talk about the menopause. Now, the menopause is something which most people will have heard of, and maybe you yourself are experiencing it or know someone who is. It's something which is often overlooked and usually misunderstood. So keep watching this video if you want to know more about the menopause, the symptoms and the treatments associated with it. The menopause is caused by a change in the balance of the body's sex hormones, which usually occurs as a woman gets older. It's when a woman stops having periods, which can sometimes happen suddenly, but it's usually a slow process where the periods become less frequent over months or years before stopping altogether. Often, the menopause is a natural process linked to age, and the NHS state that the menopause usually occurs in women between the ages of 45 and 55. In the UK, the average age to reach menopause is 51. However, 1 in 100 women experience menopause before the age of 40. So, let's talk about the symptoms of menopause. Now, most women will experience menopausal symptoms, and they can be quite severe and have a significant impact on everyday activities. The duration and severity of the symptoms can vary from woman to woman, and they can also start months or years before the periods stop and can persist for some time afterwards. Some common symptoms of the menopause include hot flushes or night sweats, difficulty sleeping, reduced sex drive, problems with memory or concentration, headaches, mood changes such as low mood or anxiety, joint stiffness or pain, reduced muscle mass, and it can also increase the risk of osteoporosis. It's worth talking to your GP if you are experiencing symptoms which are causing you trouble. GP can usually confirm if you are menopausal based on your symptoms. However, a blood test which measures your hormone levels may be carried out if you're under 45. So what are the treatments for the symptoms of the menopause? The first one is hormone replacement therapy, or HRT. This involves taking estrogen in order to replace the decline in the body's own levels. HRT can help relieve some of the menopausal symptoms, however there are side effects, so it's not advised for everyone. So it's important to discuss this with your GP to help you decide if HRT is right for you. The next one is cognitive behavioural therapy, or CBT, which is a type of talking therapy. Around 8 in 10 women experience low mood in relation to the menopause, so CBT can be particularly helpful for low mood and anxiety. Maintaining a healthy lifestyle is the last recommendation to help alleviate the symptoms of menopause. So eating a healthy balanced diet, regular physical activity, limiting alcohol intake and not smoking. Some dietary tips can include cutting down on your saturated fats and increasing your unsaturated fats, watching your salt intake by aiming for less than 6 grams of salt a day, including whole grain and high fibre foods into the diet, such as whole grain breads, pastas, cereals, pulses such as lentils and beans, and also increasing your fruit and vegetable intake, which is another great source of fibre. And lastly, including sources of calcium such as dairy products and leafy green vegetables. Physical activity can help manage the symptoms of menopause and also decrease the risk of osteoporosis. So aim for the recommended 150 minutes of moderate aerobic activity every week. Limiting alcohol can also help, so aim for less than 14 units a week and also try several alcohol-free days as well. And lastly, smoking increases the likelihood of menopausal symptoms and also increases the risk of osteoporosis. So hopefully now you understand more about the menopause, which affects 80% of women in the UK. So if this is you, talk to your GP for some advice and remember, you aren't alone.